17 minutes moving away from the hour of 9 o'clock. Welcome back to the morning show. And this morning program will be coming to you compliments National Bank. It's Policing with You, a special edition this morning. And we have some of the members from the front line dealing with COVID-19 as it relates to St. Kitts and Nevis. And the host this morning is Sergeant Richards. He's already here in the studio. We'll be back and to get into our conversation. And of course, lines will be open later on in the program. We'll let you know when. Stay tuned though.
Since graduating from college, saving has been very difficult for me. Having to pay my student and vehicle loans and hire purchases made owning my home a fantasy. So, when I heard about the National Grad Home Mortgage, I was excited and relieved because the National Grad Home Mortgage consolidated all my consumer debts, plus, most importantly, providing funding to build my dream house with one monthly payment. Thank you, National Bank.
Visit any of our National Bank branches for more details about our National Grad Home Mortgage. When you bank at National, you invest in your future.
Welcome back to the program, and good morning, Sergeant Richards. How are you doing today?
Good morning, GQ. How are you? Good morning to all the listening audience out there in radio land, at home and abroad. This morning, as GQ would have indicated, we have a very special program this morning. In light of the announcement made by Senator Wendy Phipps yesterday, we thought it prudent to bring a couple of the members from the task force and those of us who operate on the front line to not only inform and educate you, but also to debunk some of the myths as well. So I'll allow the guests to introduce themselves.
Morning, this is Dr. Keisha Liddy, Director for Community Health-Based Services within the Ministry of Health.
I'm Dr. Al Pierre, the Vice President of the St. Kitts Nevis Medical and Dental Association. I'm also the Director of Health at Ross University.
My name is Rondon Carr. I'm on the COVID Task Force Information Resource Coordinator.
Yes, so thank you once again. I'll start with Dr. Liddy, mainly because I know you better than I do the others. Up until a few months ago, we never heard anything about coronavirus. Could you shed some light as to what the coronavirus actually is and how it affects us?
Okay, so coronavirus, as we now refer to it as COVID-19, is a novel, meaning new, coronavirus that was identified during an investigation of an outbreak in Wuhan City, China, December 2019. Since then, we know that from December till now, this virus has spread and affected hundreds of thousands throughout the globe. As of today, I think we have reached more than 489 plus confirmed cases globally.
Wow.
Yes, and we know, as you've said rightly, that here in St. Kitts we have our first 2 confirmed cases. So this coronavirus mainly affects individuals by giving respiratory symptoms, and we have heard of these symptoms: fever, cough, shortness of breath. And it can affect persons on a spectrum or range from a mild condition to a more severe disease outcome. Fortunately, I hope that persons have understood the fact that most persons who would be affected or have been affected with coronavirus or COVID-19 actually do get a mild form of the disease, and a very minute percentage go on to have severe outcomes such as pneumonia in both lungs or even multi-organ failure and death. So the information has been out there, website, educational pieces on radios, press conferences from the Ministry of Health, other stakeholders, and as you've rightly said, it's new, but it feels as if it's been here forever because of the toll that it's been having on different territories and different persons throughout the globe.
Indeed. Dr. P, anything you want to add to that?
No, I think Dr. Liddy has quite aptly captured, not only the nature of the disease itself, but I think people ask me all the time, what makes this so different to the flu that kills almost 600,000 people around the world every year? And one of the things that I tell people is, when you're fighting an enemy that you know nothing about or know very little about, it makes it so much more dangerous. And that's what makes this dangerous. We're getting news that it seems almost every hour, every day, every week, things are changing about this disease. For example, even the time, the duration on surfaces. 2 weeks ago, we were told after 12, 24 hours, there was no harm. Now we're hearing on plastic and metal, it's 3 to 5 days. Wow. Right? We're hearing that before we were told, it's transmitted via respiratory droplets. Now we're being told that 3 to 5 hours later, the viral particles can circulate in the air. Wow. Right? So those are the things that makes this particularly dangerous. We're also hearing information that tells us that even asymptomatic patients spread the disease. That is unheard of. Typically, you can tell somebody has a flu and you stay away. But imagine if the viral particles begin to shed, meaning that I can actually infect someone before I begin to demonstrate symptoms. And there's no set incubation period. So some individuals show symptoms from as little as 2 days, some as 14 days, and there are even outliers as far down as 24 days before symptoms begin to demonstrate. So imagine when I tell people, can you tell me everybody you got in contact with for the last 24 hours? Most people cannot say. So imagine asking you where you've been for the last 2 weeks and whose hands you shook and who you're in contact with. It gives you an idea of how quickly this thing can spread and how it can wreak havoc on a population. So the measures like social distancing, the measures that we say, for example, individuals to quarantine, and I think later on the show we'll make the distinction between quarantine and isolation because they're used interchangeably. I think it's also creating unnecessary panic in the society. But this is why governments are taking, which is a very difficult measure, to shut down a country and to shut down its borders. The economic impact is severe, but to take those decisions, they're not taken lightly because that is the only thing that has been shown so far to curtail the spread of the disease.
To contain it.
So we have a disease where there's no known treatment. There's no vaccine to date. Right? So we're up against something that has the capacity to wreak tremendous havoc on our nation.
So basically, we're waging war with a foe we know nothing about, as you rightfully said. Well, my second question is, what are some of the myths that you've heard about this virus? And please, debunk them as best as you can. What are some of the myths you've heard, Dr. Archibald? Dr. Liddy, sorry.
That's okay. Archibald is the maiden name. I think I would like to start with one area that I know is an area of great uncertainty, and that would be towards therapeutic or medicinal measures that are out there to treat or prevent coronavirus. I know persons have been privy to a lot of different information based on what is good for coronavirus, whether it is a bush, whether it is a certain home remedy. Now we must realize that although there are home remedies or medicinal practices that can help alleviate symptoms, because remember we said the symptoms are very close to what is the common flu, and most persons will have the mild form of the disease which will show as a common flu. So there are actually home remedies that we often use to alleviate those symptoms, but we must be cognizant that it is a myth that it is something that is recommended already to cure or treat COVID-19. Okay, there are ongoing clinical trials to help to put forward basic recommended therapies, but nothing has been out there as a concrete consensus as to this is what we use to treat corona or this is what can cure it. So that's one area I know for sure there's a lot of myths and misconceptions about.
Yeah. Well, in my case, I've heard things from black people cannot get coronavirus, to which I think it's pretty evident now that is not the case, right? I mean, it's just a matter of time before it got to the place where black people are. I don't know how many black people there are in China, but I can imagine it's not a lot. There are other things as well, which is very important. Is people ask me, for example, if like my daughter actually called me and said to me, "Dad, I just want to get coronavirus so I can get over this," because people are of the opinion that I can't get it again. And that is one of the things. Remember, a virus multiplies so quickly that mutation is always going to happen. And when a virus mutates, it means that it creates different strains and different copies of itself. That has the capacity to reinfect you, right? So that is something that we must be cognizant of. If you look at the vaccines for influenza, there are several types of influenza, and that's because the virus will mutate over time. And when that happens, you can get reinfected with a different strain of the virus. So that's important to note. Yes, we expect some people to build some immunity to the strain that's going around, but the chances of being reinfected. There's also situations that I think is also important because there's mixed information regarding treatment. So far, there are certain drugs that have shown in some settings, and also dependent on the time in which it is employed, to show some improvement. So we have a drug that is used for malaria, which is called chloroquine or hydroxychloroquine. But there's also reports of individuals who took chloroquine and died. Right? So a lot of individuals, you may come to the hospital and a doctor may start talking about this medication and you might be hesitant to take it. Or you may be coming to the hospital and begging for chloroquine because you're getting cures. So there's studies out. The thing is, when you're fighting a fire, all you can think is getting that fire out. The time for research, there isn't enough information to allow us to know for a fact anything at this point. We're still in the learning phase of this. However, we've shown some improvements with drugs like azithromycin, drugs like chloroquine. There are certain Calitra, which is a drug which is used for HIV, and so on. There are some treatments that have been shown in some settings to have some benefit, and I know that should we have those cases on island where where those treatments are required, we will do everything. But it's still something that is not evidence-based in a sense, right? Because a lot of the research is still just coming out on that. So that's one of the things that I think we should be mindful of.
I get you. And even though, if you permit, even though you're doing your research now, it's still new.
Absolutely.
It's still new, so you don't even have that legacy to say, well, you know what, we've been observing this for the past 15 years, so we can work on the trends. Right. You can't do that right now.
You can't do that right now. You can't do that. I mean, there are people who say to me, I mean, most people I've spoken to, I've been around the island, going to the churches and so on. I speak to people, and the first thing people say to me, Doc, I will not be taking the vaccine, you know, because this vaccine is like cell phone. It's like cell phones. The first batch always recalled.
You know what?
And I don't want to.
Nobody wants to be the guinea pig.
Nobody wants to be the guinea pig for the vaccine. So, you know, I mean, those are some of the things that we're up against. I mean, right now, the greatest thing right now is to actually get a vaccine and perhaps immunize individuals against the strain of this virus. But the individuals will be reluctant to take vaccines. I mean, vaccine got a bad rap in the last couple of years as being the cause of autism and so on in kids.
Yes,
you know, so so with that that being on the heels of vaccines getting the bad rap, you can understand people will be very reluctant. Yes. So you know, we're the frontline workers. You know, I always like the fact that my profession is called the practice of medicine, which tells you it's not a perfect science.
No, it's not.
You know, so that being the case, it is about really putting a level of trust in our frontline workers and working with them to make our jobs much easier. And I think we will speak more to that because it is a difficult job that we have ahead of us.
Indeed. Thank you, Dr. P. So what are some of the things that you would advise that people do to protect themselves, and protect themselves from the spread of this virus?
Well, I mean, first of all, there are many things that we can and we should be doing. And I mean, you know, those things are things that I always tell people we should be doing for a long time, with the common cold and common flu. We've been spreading the flu because nobody dies from it in our setting. We you know, people have the cold and flu and show up to work, and next thing you know, an entire office is down.
I'm a devoted worker. You know, even when I'm sick, I'm coming.
Yeah, you know, and you're doing, and you know, you're really doing a disservice to individuals. You know, you see it in preschools, for example. You know, your child goes to school perfectly normal and comes back at the end of the day with a cold and flu, and you know he or she got it from somebody else. So the first thing is, if you have symptoms of any flu-like symptoms at all right now, the best thing is to stay put, stay home. You're not doing anybody any kind of service by coming to work. So if you have symptoms of the flu, you don't know what they are, and as Dr. Liddy alluded to earlier, the symptoms of coronavirus mimic that of the common cold. Right, in most individuals, a little stuffy nose, a little headache, congestion, a little sore throat, a little fatigue, malaise, get up in the morning, body achy and so on, a little fever. You may think that's the flu and you can go into work because your tolerance is so much higher than anybody else, or your work is so demanding, right? And you go to work. So that's the first thing. The second thing is, of course, practice hand hygiene, proper hygiene. I know we talk about covering your cough, and one of the things that has been recommended is is trying to cough or sneeze in your elbow. But that's what I tried that with a few people at church, and most people, because of their body mass index, their elbow couldn't reach anywhere near the mouth. So I'm actually reluctant to recommend that these days. Yeah, it's a reality. I said let me see, and most people the elbow got shy of the mouth. So cough in a tissue, not a handkerchief, because you take that home with you afterwards. A tissue. Dispose in the proper bin to ensure nobody else gets in contact with it. Wipe surfaces down as often with alcohol-based products. You don't have to use anything fancy. Alcohol and bleach will do the work. There are women who don't want to use bleach because if they lean against it, they'll stain their skirt or bleach their skirt or something. But alcohol will do. So the best thing for hand hygiene is soap and water.
And it's just to kill the germs on the surface.
Yeah, just to kill the germs on the surface. Soap and water will do, right? And if you don't have access to soap and water, the next best thing is an alcohol-based sanitizer, not Purell. That's a brand. Right? We like to use those brand. Every bleach is Clorox, and every toothpaste is Colgate.
Indeed.
And every hand sanitizer is Purell. Alcohol-based sanitizer, 60% alcohol is what is recommended. And of course, if you have symptoms, do not show up at a place where others are waiting for other things. Don't go to any department where the person is waiting to check their blood pressure or something and so on. Call your doctor. Call your private doctor. I know the government doctor, Lily, can speak to that more than I can. The government has set up a hotline, 311. And I will say, whenever I say that, I will say, we also need people to answer the line. So if you're okay and you're healthy and you can be trained, sign up at the Ministry of Health, because there are 6 lines. I mean, it needs to be manned 24 hours a day, 7 days a week. So we need individuals to be trained to be on the other side of those lines as well.
Okay.
Right? Okay. So that's one of the things that we recommend. And of course, we can speak later to quarantine and isolation.
Can I jump in, Sergeant Richards?
By all means.
Seeing that you're on the whole testing aspect of it, I've heard in the news, in the United States in particular, they're struggling for test kits, if that's the term that they use. Are we equipped to deal with if it get out of hand, so to speak?
Okay, so our testing capabilities extend presently to one private laboratory that can offer local testing, and our regional partner with CARFA. So anyone who we take a sample from and need that sample to be tested, the sample is sent to those 2 avenues.
Right.
One to Next Generation Lab, which is a local lab that will be offering testing, and to our regional partner in CARFA. So we have not even reached the stage where we have what I think you're alluding to is rapid testing.
Yes.
So rapid testing is not available, and actually the WHO and PAHO, our international partners, have not recommended us to use rapid testing kits because they're not FDA approved. But of course, as you've said, it's being used in other jurisdictions because of the
high demand,
mass requirement for it.
Right. Okay. You made mention of a local institution here. Can you walk in, or do you have to be recommended by a doctor?
Recommended, because we need to make sure that we test who needs to be tested. You just mentioned that test kits are scarce no matter where you are in the world. So we have to make sure that persons who are tested actually need to be tested, and that is that they fit closely or they fit absolutely the case definition of a COVID-19 case. So if yesterday you wake up with a fever and a cough, you've never traveled, you've never even left your house, please, we can't just test everybody. So we still need to be in line with what is a proposed or possible suspect or probable COVID-19 case, or who is a contact of someone who has a confirmed condition of COVID-19.
And I see your dilemma, because at the end of the day, as you mentioned earlier, the symptoms are of a common cold, a common fever. Absolutely. So in this atmosphere, if I can put it that way, the minute someone starts to show a sign, the first thing that's going to come to their mind is that there's a possibility that I might have this coronavirus. Right. So, I hear you in terms of saying, well, try and exercise patience and see if you get over it. But at what point do you not panic and find the right person or doctor to talk to. That's the balancing act I see that you're dealing with.
Yeah.
Well, GQ, the reality is right now you panic for everything.
Yeah.
You know, you have a stuffy nose, you have a cough. Right now, the rate at which things are, you panic for everything. And like Dr. P said, there are persons who would be inclined to, okay, let me go to the hospital, let me go to A&E. And then you go there and you find there are 1,000 people at the A&E waiting. You put yourself not only in greater risk if you don't have it, but if you have it, you put other persons at risk as well.
Absolutely. I mean, I don't know how many of you saw the meme going around. You know, once you feel the scratch in your throat, is that your Rona?
I've seen so many memes.
So anybody who has a cough and cold, but I think the ultimate thing is that, you know, and this is why the hotline is so important, because information is a very, very powerful thing. If you have information and the right information, because what is happening is there's a lot of misinformation around. This is why we always encourage individuals to listen to that one source of information, which is the Ministry of Health. You know, there's things coming out of the woodworks. I mean, you know, but you want to listen to a reliable source of information, and that is the Ministry of Health. That is the authority that we have locally on the coronavirus situation. Anything else is simply not trustworthy, right? So the 311 hotline, that's why it's so important. If you have flu-like symptoms, that is something you should call. We're also advocating for all our members of the Medical and Dental Association to have a hotline themselves. Right? Have your phones available so that your patients can call you and say, Doc, I'm home right now. I just started with these symptoms and so on. What should I do? And you will be advised accordingly as to what to do. If your symptoms meet the case definition of somebody who may have COVID-19, you will be tested. Right, but imagine you show up to NextGen and you show up, and if you know NextGen, I've been there, you press the button and there's a camera, you press the button with the same hand that you may have coughed or sneezed in, and then you go into NextGen and the young lady there doesn't have a mask on, she doesn't know what you're there for, and you say, can I have a COVID-19 test? And then suddenly everybody's running like headless chickens. So that's not the best approach. Have someone come out to you, reach out to someone first if you have symptoms. If you meet the case definition, we will arrange for you to get tested.
Sergeant Richards, what I'm going to do right now, we have a Mr. Kerr in the building. We're going to touch base with Mr. Kerr after the break. We're going to open the lines for you as well. Soon we'll indicate when you can call. I'm sure you have some questions or concerns yourself. This morning program is coming to your Compliments National Bank. We'll be back right after this.
Whether you're at home or abroad, ZIZ's social media platforms help you stay connected with what's going on in St. Kitts and Nevis. Keep up with daily events by liking our Facebook page. Follow us on Twitter at ZBC Online. Like our pictures on Instagram and subscribe to our videos on YouTube. Also, you can watch us live on the ZIZ mobile app and our website, zizonline.com. No matter where you are, ZIZ is just a click away. ZIZ Broadcasting Corporation, reaching you wherever you are.
All right, welcome back to the program. For those of you that are staying on your radio, we have two doctors in this studio with us and a representative from NEMA, correct?
COVID Task Force.
COVID Task Force. And of course, our host this morning, Sergeant Richards. We'll be taking your calls in just a bit. Dr. Liddy and Dr. Pierre. Correct. Make sure I get the names. So at least when you're calling, you know who you're speaking to and who you can address your question to. Before the break, we've touched base a lot with the doctors. What about you, Carl? What's your role in all of this?
My role with the COVID Task Force is Information Resource Coordination, which is basically I get the information as it relates to COVID-19, news, prevention methods, and outside of that in terms of what resources for education, health. We try and compile all of that so that you're able to access it, we're able to provide it for you, and then ensure everybody is well informed. As the doctors have spoken before about rumors, there's a lot of rumors circulating. People are saying, I hear this, I hear that. And in the information resource, and you said, where did you hear it from? And I said, oh, well, I said, yes, but you're not getting it from a source. And as I tell people, if you hear something medical, contact your doctor. And one of the most important things I said, you guys like and share. Don't like and share get informed. If it's true, then go ahead and share. But a lot of people, their instinct is to just automatically send it out, and that causes a lot of confusion. It causes a lot of panic, and as we've said, for right now, it is an unknown virus, so we want you to have a level head about it. And some of the things that we're asking you to do are not new. You know, I try to say for a lot of things, as for myself, because I'm in that category of people who are foremost concerned because I have respiratory issues. But because of that, I'm more informed on things I have to do to protect myself. So we tell people, get that information, get informed, understand the situation. This is not the time for you to panic, but it's the time for you to get educated. And as I mentioned, for a lot of these things, we have been told time and time again, I show your mother smile, she said, look how long I tell you wash your hands. Look how long I tell you to A, B, and C. These things, I put it is a cause for concern. And a lot of times I say, I don't want to say that it's a different environment now, but it doesn't, I think a lot of the times is when we hear you can't do this, we can't do that, we feel restriction. And I said for some of the things when with information resource, and I talk to them about it, it is that mentality, that fear and that concern that triggers certain behavior. And then, you try and calm them down. For example, I said, I can't leave my house. I said, yes, you can't do this, but you can do this differently. You don't have to. I said, this is forcing some people to get educated on technology, to try and stay home as much as possible. You can't, I wouldn't say you can't, but we're saying don't go out as often. But if you need to pay a bill, all the banks have online services, you can pay online. People are like, I can't go watch a movie. I said, haven't seen a movie in the theater in 8 years because Netflix came about. So I said, you have those things. In regards to education, and they have the concern, I said, aside from you having to stay home with your kid, education itself provides, for some of them, distance learning. And again, through ICT, they have resources, even for private sector, because that's what they're there for, an innovation center, that if you need help and you say, hey, listen, I want to work from home, I want to protect yourself, you can contact them and they will provide that information and say, here's some options for you that you can use so you can stay home but still stay connected to your workplace. So majority of that is trying to get that information out there, ensure that people are well informed, and try to get them to calm down and understand it's a stressful situation, and any any unknown thing will cause that. But in this kind of environment, we need you to again, I say it a lot, stay calm, make sure you're informed about the situation, protect yourself, and I think the doctors can speak about this. And I would talk a little bit more about community and ensuring others around you are following these practices, and especially those of the most vulnerable in the community. We don't talk too much about mental health, people who are of a certain age and disability, that we also need to check on them. Now they're in that position. So this is a time, like I said, not to spread rumor, for us to come together as a community, make sure that everyone is informed, make sure that everyone is doing what they need to do, and we can, get through this situation.
And on that note, in terms of information, which you rightfully touched base on, I'm aware of the Ministry of Education doing their bid. I'm aware of the Medical Association doing their bid. Can you highlight any other information platforms that are credible that you can highlight now that the people can add to their list?
World Health Organization. I also say SKNS. ZIZ Naturally. Actually, ZIZ has a COVID-19 page. So if you go to zizonline.com and you'll see a link for COVID-19. You see all the resources, and that's in collaboration with the Ministry of Health, NEMA, SKNS. So you will see all the tips, all the videos, all the press conferences, and everything is up to date. So even from the address the PM gave last night, that is there as well. So that's a wealth of knowledge for you to go through and make sure you're informed of what, and stay up to date of what is exactly going on in the region. Another thing I said, for those of you who need a little bit extra assistance in terms of school and education, you have the Ministry of Education, and you also have the ICC Center. You can contact them and say, listen, I need A, B, and C, and they will try and facilitate and assist you at best they can.
Thank you, Mr. Kerr. Sergeant Richards?
Yes, my next question. According to the Minister of State with responsibility for health, the 2 confirmed cases were individuals who would have arrived in the Federation on March 18th, and they would have been tested on March 20th, and they were both confirmed as positive for the COVID-19 virus. It was also stated that these persons were in quarantine from the time they arrived back into the Federation. What I would like for you to do, both of you, Dr. Archibald and Dr. Pierre, sorry, Dr. Lee, I keep forgetting.
Don't leave the husband out, man.
I've known us in school, so it's hard to get rid of the Archibald.
Yeah.
But if you could just briefly explain the difference between quarantine and isolation, because persons use the words interchangeably when they really are mutually exclusive.
Yeah.
So if you could just express the difference now to educate those of us who really don't know the difference between the two.
Okay, so you rightly stated that both are different, but let me say that both are needed. They needed prevention, containment, control measures to help us prevent transmission of the disease. So both are measures that have to be employed, okay? And the difference here is when we speak of quarantine, we speak of separating or restricting the movement of persons who are not sick. They're not ill, they're not showing any symptoms. We are asking persons to limit or restrict their movement so that they do not, if in the event that they become sick, be exposed to any other person. So that quarantine period allows for a period of observation such that if symptoms arise, the case is easily detected and that person can then be self-isolated or isolated in a treatment center. So quarantine means you're taken away or your movement is restricted, not because you're ill, but there is some level of risk of exposure, maybe through travel history, you've been to a place where they have confirmed cases, or you may have been exposed to someone who probably was a COVID-19 case, but you yourself, you're not ill. We're just asking you to stay put, lay low, such that we have that observatory period to see if you do develop symptoms. Isolation, on the other hand, speaks to separating somebody who is sick, okay, from other persons, such that we again reduce transmission. Okay, so there's a big difference there. People can self-quarantine or voluntarily quarantine. Those are persons, as Dr. Pierre would have said, if you feel like you still think that even beyond what people are saying, you think that you have been exposed somehow, or you just want to make sure that you stay safe, you can self-voluntarily quarantine, which means lay low or restrict your movements. You may be asked or be requested to go into quarantine, such as this is what we have been doing through port health surveillance, where we know definitely persons have traveled to areas that have confirmed cases. They may not be able to explain their level or risk of interaction or risk of exposure, but we know that you've been in the jurisdiction where they have confirmed cases. We ask or request persons to self-quarantine, so they're not diseased individuals out there, they're not confirmed cases. We are asking persons who have some risk of exposure, but they have no symptoms, to just self-quarantine or lay low. Isolation, as I said, these are persons who are asked to go into isolation are persons who are already sick. So you may be at home. Even to our first 2 confirmed cases, they are asked to self-isolate because they're not persons who are sick or the health status is not of such concern where they need to be hospitalized. So they're actually self-isolated at home. Okay? So isolation speaks to that either confirmed or persons who are ill. I think that's the big distinction, and I think when we are finished exploring that, if anyone else has something to add, we need to really cue in on helping people realize the importance of these 2 measures, because they are the ones that are going to help us really contain, control, minimize the effect of COVID-19 in St. Kitts and Nevis.
Indeed.
Thank you, Dr. Lady. Sergeant?
Yes.
We've been joined by Mr. Abdiel Samuel,
the National Disaster Coordinator and the head of the COVID Task Force, yes.
and I know that you have not indicated that the lines are open as yet, but we have 1 or 2 calls queued up to get in. If you guys are okay with that, to address those callers, you okay with that?
Yes.
All right, so let's take our first call for this morning, and ask your question. Don't to interact with the guest this morning. When you're finished, we'll reply to you. Hi, good morning, you're live.
Hi, good morning, sir. Good morning, Mr. Liban, and good morning to your guests there at ZIZ Radio. Question: what happened to the other passengers that came down on that flight? Are they locals? Other locals was on that flight, and if they're in quarantine at this moment? Thank you.
Thank you for your question. I'll let the individuals in the studio answer that.
Okay, I will give the answer, and my answer would be that, remember, it was just of yesterday that we would have confirmed our 2 first cases. So what happens as a public health response is that we are now engaging in robust contact tracing. So yes, individuals on the same aircraft or airline will be fully interviewed because we have to assess what contact means. If you were in the cabin and you are the pilot and a person with COVID-19 is sitting in a certain aisle, there's a buffer zone around that person where we have to now identify who are contacts, and that buffer zone speaks to at least 3 seats in front, behind, and 2 laterally, right and left. So that robust interaction and interview of possible contacts is ongoing right now, and then we will ascertain, based on that risk assessment, who should be tested, who are actual contacts, yes, no.
All right, thank you very much, Dr. Liddy. Another question. Persons have some concerns about persons who are in quarantine or in self-isolation not staying there. Can you address some of the concerns that they have, and additionally the misconceptions? Are these persons being monitored who are placed in quarantine, and what measures are being taken if it is found that they are breaking the quarantine, the mandated quarantine?
Mm-hmm. It's a good question, but I want to backtrack a little bit on, when I explain what is quarantine, we also need to look at the feasibility, the adequacy of quarantine. Now, certain things must be in place. Persons who are quarantined, they have a human right. Things must be in place to make sure they have a level of comfort and their needs are met. So persons who are in quarantine still have to eat. They need to have food. They need to have a level of entertainment, access to news, access to information. And quarantine itself, in terms of where you're quarantined, has to be adequate. So persons can quarantine at home, they can quarantine in a hotel, they can quarantine in a dorm, they can quarantine in another facility. So where they are quarantined would really impact on how well quarantine is played through. So these factors may influence why persons may break quarantine. Now there's the quarantine regulations and the legal framework and backing for dealing with persons who break quarantine, but we have to be mindful as a society that this is all new to us. Yesterday, a month ago, nobody had to be told you have to go into quarantine. They didn't have to drop everything and just keep themselves at home.
Now you have several persons.
And now we have, when the press conference was held, we mentioned that there was more than 290 persons in quarantine. Indeed. 290 persons in quarantine doing something that is new for them. So if persons are making a trip to the grocery, we have to be cognizant of the fact that these things must be in place for quarantine to work. And therefore, these may be factors that influence that. It's not right for them to break quarantine, but we have to be very careful. And what I want to add is that factor of being our brother's keeper. Now, is it really necessary for us to just send a WhatsApp message or raise a whole level of anxiety for everyone and say, well, the people in quarantine not staying in quarantine, are they being followed up? We have to look at our social responsibility, our part to play in this process. People need help. You need to maintain that communication line between their families and friends who can help them stay in quarantine. So we have to be our brother's keeper. And I said before, yes, we do have that collaboration between the National Security, NEMA, to help us assist in monitoring persons and making sure that they're in and making sure they have the means to stay in. But I think we need to expand this as a national approach and realize, as I said before, quarantine and isolation are two measures that are needed for control of this disease, for containment, for reducing local transmission. And therefore, we have to find out what is our part to play as citizens for persons who are in quarantine to assist them and to help us as all as citizens of St. Kitts and Nevis to get this to work. It has to happen, and therefore we need to look for and see what is our part to play.
Lady and gents, we have another caller. All right.
Hello.
Good morning. Thank you for your patience.
I'm calling to find out, right? Did the person who came from New York, did they know that they had the coronavirus before they come back?
All right, thank you for your question. Doctors, which one of you would like to address that one?
And it's you know, I think we also have to highlight what people sometimes place a lot of emphasis on, and you know, of course, this is by our very nature, we're very community oriented. You know, gossip and that sort of anything to make a story more to sensationalize it is always one natural tendency. But I think sometimes that sort of steers us away from what the most important tidbits are. As far as we know, the individual was not tested in New York. They were not cognizant of the fact that they had contracted the coronavirus. So that is let's put that aside. But I want to point to something that Dr. Leedy said, and I've been going to the churches, and this is the time for community groups to step up. The churches, other organizations in our community. The Caribbean is well equipped to fight this by our very spirit of community, which comes natural to us. And this is the time to be our brother's keeper goes both ways. One, to see how we can reach out to individuals, because we may not even need to spend any money. It just means that you're in quarantine, I can go to Rums and pick up your groceries and have it delivered at your door for you, right? And the person will leave the money outside, and you can go and pay for it or whatever the case may be. This is the time to step up. It also means that individuals in quarantine must also be their brother's keeper, because if you're in quarantine, you perhaps want to choose to go to Best Buy at 2 a.m. when it's less crowded. You may choose when you go to Best Buy and you use your shopping cart, you wipe it down, right? Even if you have no symptoms, because as I said before, there's asymptomatic spread of disease. So even if you don't have the cough and cold, and the individuals who may have a little thing but downplay it, right? And you can still spread the disease. So we have what, and I think if we harness those things, because a lot of the gossip is gossip of division. Well, this is the person who has it, and therefore this is the person who brought COVID into the island. That is not going to help us in this fight. If we come together as a people, if we harness what comes natural to us, if the churches got involved and ensure that we call in this, so the gentleman over there spoke of mental illness. A lot of individuals will get depressed. There are people who are thinking of their jobs after this. There are companies that will close down. Last Friday in the U.S., over 2.4 million unemployment claims were filed, right? 2.4 million people on the breadline. That is the reality. It means that those helplines, the 311, alongside the doctors, speak of frontline workers, which are the policemen, the doctors, the media individuals who have to keep us informed, right? We need more people on the front line, because if we all come out together on the front line and play our part, churches also to set up hotlines, to bring comfort, to bring support to individuals who can call in prayers. Pray with your congregation and those in your community. That is what needs to happen. If we do that, I think you know, we speak about having a dearth of resources. We don't. We don't have a dearth of ideas. We don't have a dearth of our spirit of unity. And that's when we have to pull those things together in this fight.
465-255-525-55 while we wait for another call. Sergeant Richards.
And it's interesting you remember you mentioned being on the front line, because that goes to my next question, and I know Mr. Samuel has been an advocate for this, so maybe he can expound on it some more. It is easy for persons to say they're practicing social distancing and they're just not going to work, but everyone in this room does not have that luxury or privilege, because we're all here on the front line and we have to be on the front line no matter what. So what are some of the things that the general public needs to understand about us who are on the front line, and what can the public do to make our jobs easier to help to protect them?
Okay, I will defer it to the doctors so you could get the science out of it. So doctors, I think I will allow you to address that, and then I will give my input.
That's fine.
Yes.
No, I mean, listen. So much of the focus, just look at other jurisdictions in the U.S. right now. So much of the focus of this has shifted from the patients to the frontline workers. Yep. We now have a situation where just recently the CDC released a guideline that if you have had a high risk contact with someone, imagine someone who is positive for COVID-19, you should continue to work. Because one of the biggest problems that we may face is that there aren't sufficient workers to meet, and I think Mr. Samuel is perhaps better equipped to speak up that this flatten the curve thing we've been hearing, and why this is so important about flattening the curve, why social distancing and those things help to flatten said curve, because the problem that's going to happen is that we will overwhelm the services to the point that we will run out of equipment, we will run out of stamina. Right? That's what is likely to happen. And when those things happen, that's where it places as additional risk. We've seen videos, and they may seem funny, of police officers stopping individuals, and if you know you don't have your license, you cough or sneeze, and therefore the police officer is in two minds as to whether he should continue to search you or whether this might be COVID. There are individuals who may use those things in maliciously. Right, so as a police officer, for example, you may now be asked to look into a vehicle, and you may have to ask someone, "Sir, I'm going to be looking into your vehicle. If you need to cough or sneeze, turn your face to the side. Step out of the vehicle." Step out of the vehicle. We have a moral and patriotic responsibility as frontline workers, and we have to be there. We don't have a choice to be there. Yesterday, I was at people's homes in my spacesuit, as it's called, testing individuals. All right, I'm out testing a guy yesterday, and my stethoscope gets hooked in the mask, and I'm trying to get the stethoscope on, and the mask is out, and the guy is coughing violently at the very same time. Right, that's what we face, and we go home to our families. We have those things, right? So this is where compassion comes in. Yes. With individuals knowing fully well that you need to protect these individuals, because if we fall, if the police force falls, and you cannot provide law and order in a time like this, imagine what happens. Imagine the media personnel cannot be out there to tell us what's happening, give us information. Imagine if the healthcare workers, doctors, nurses cannot be out there, fire individuals cannot be out there doing the work that needs to be done. So you have a responsibility. I'm not asking anyone to do this, but sometimes we perhaps can don't need to reinvent the wheel here, because this is happening in our jurisdiction. You see places where, for example, restaurants and so on are delivering food to frontline workers to ensure that you don't have to be thinking of where your next meal is going to come from whilst you're at work. Because every time I leave the hospital to go out to find something to eat, there's a good chance I'm transferring something from the hospital back to a restaurant or somewhere else, right? So those are the things that I think this is the time, again, I want to just speak on this and reemphasize, and the redundancy here is valid, is that our spirit of community now, and we need to protect our frontline workers.
Dr. Pierre, it is,
yes,
right?
Yes.
I think Dr. Pierre has summed it up, but GQ and Sergeant, I have to speak on this. Just imagine, from 2 in 1 week, we could end up with over 5,000 people being self-quarantined. Let's take a look at what we have in our health sector, the resources that we have. Not even the great United States, not even the great China, nobody has been able to control. What that requires is this all society approach. We need all of society approach. For example, I was just amazed rushing here. I was dealing with a matter with a business place, and coming here, it was amazing to see that our people are still congregating in large numbers. We have been, you understand my passion, GQ. If 5 of us starts the process and multiply it by 5 and multiply it by 5 more, it will make the job of the health sector frontline people so much more easier. Hey, social distancing, 6 feet apart. Why is it so difficult for us for now to change our cultural norm for a time to combat this virus? That's all we're asking. 6 feet apart. Listen, if you feel sick, stay home. Why go into a business place? Why go into a large crowd knowing that you may have potentially been exposed and going to continue exposing people? Listen, the line can wait. Indeed. Everything else can wait. This is time where we need to pull these resources together. Now, look at it. As the doctor just said, he had to go deal with this patient, he has to go deal with this, and he has to go deal with that. Then here's the fall off. Then police have to be providing security for this. We have to still make sure that the police is carrying out all the other duties. We now have to look at the transportation. I mean, this morning I saw buses full, ram, right? I actually just came from engaging the Ministry of Transport, because we need to, this is something that we need to address there with a sense of urgency. Remember, right now we have to treat everyone as a suspect. So really and truly, GQ, respectfully, to me you are a suspect. What does that mean? That I have to employ everything that the Ministry of Health has been saying, safeguarding myself. I mean, we need to have these personal plans for ourselves. We need to have a family plan. This is not time for excuses. If you have a 1-bedroom home, listen, let the authorities know. Don't just say, listen, I just have 1 bedroom and I don't care, I'm going to lie down. Next thing you get, you're exposed, you contract the disease, then guess what? You're going to the job. And when you go to the job, you're hanging out with everybody else. Imagine if 60 people are on that job. You expose 60 persons. Those 60 persons go home to their families. Then they expose their family. Then that family exposes everybody else in the community. Then what happens? I understand it is something new to us, GQ, and we need everybody on board right now to stop this. Otherwise, our society is going to become very challenged. So I want to make this appeal to the general public to adhere to their warning and advisories. I also want to ask the communities to support police community initiatives right now. We have the school children home at the moment. We have to police them. We have to talk to them. We also have to police everyone who is in quarantine. If you know, say something, talk to them, say, listen, stay home. You understand? We don't have a police officer, we don't have a health official to put by every home. Our society has to assist us in this fight. If we don't, then we are going to be challenged. I think right now we have an opportunity to contain it and do the necessary to get St. Kitts to a state of normalcy again quickly if we do the necessary things right now.
Thank you. We have a caller on the line, hopefully. If the call is not there, we'll take a break and we'll be back and we'll jump right into the phone calls after the break. Hi, good morning. Thanks for your patience.
Finally, JQ. Thank you. I have a concern and a question. Were these people tested before they boarded the flight to St. Kitts? And if not, that is what they have to start doing instead of waiting until they disembark to test them. So I need some clarity on that there, please. Thank you. Have a nice day.
All right, what we're going to do, we'll address that question after the break. I know a number of you have concerns. I see the lines ringing. And so what we're going to do after the break, we'll address that concern, that question/concern, and then we'll take some more calls. right, welcome back to the program. We had a concern / question before the before the break, I should say. I'm going to let Dr. Pierre address that. And then after Dr. Pierre, I'm going to let Abdias Samuel, address his concern, and then we'll take the calls. So for those of you who are trying to get in, please do be patient with us.
Okay.
Doctor?
Sure. The question was regarding whether the individuals were tested before they came on island and whether that should be done. I mean, just think of the impracticality of something like this. The question is, who would do the testing at the gate? Would you have healthcare workers testing 176 passengers before they board the flight? Would the results be ready in time before the individuals get on the flight? So that's not practical. And this is why governments around the world have enforced shutting borders down. The Prime Minister announced why all commercial flights will be stopped until further notice into the Federation, and that's why those measures, as draconian as they may seem to individuals, they are the ones to be proven to be most effective. So no, the individuals were not tested before they came. There was no knowledge of they having coronavirus before they came into the island. But as responsible individuals, as we all should, they came into the island from an area where there was community spread of coronavirus. They entered into quarantine and then were tested once they began to show symptoms.
GQ, one of the things that I want to appeal and urge the general public to do is to stay calm. We are seeing a lot of panic buying. It's not necessary. I can assure you, and we can reassure you, that we have been in dialogue with the suppliers, and they have sufficient adequate supplies to carry us through an adequate period. There is no need. Also, it is important. I mean, there's one thing to critique the system, which we welcome, because, it keeps us on our toes and we also be able to identify gaps. But there is also the gap whereby society has to take up the civic responsibility. If you go to the supermarkets, how much persons are crowded? I mean, the crowded. Why not do simple things like, hey, listen, social distancing. What about staying a cart apart? So you're pushing your cart is apart. If you're not pushing a cart, you see the model, somebody practicing, well, let's follow that. Let's have the distance so that we can protect the cashiers who are working diligently to serve us. We are protecting the persons who are around us. And guess what? We are preserving our healthcare system. We have to think about all of that. So there is no need at the moment for panic buying or shopping. It's not necessary. Keep calm. Support the system right now. One of the things also, GQ, is that we have a lot of moving pieces. We have now confirmed that there are 2 cases in St. Kitts and Nevis. We now have to support the system. By how? Practicing social distancing. Social distancing is not just only you from here and I here. It means that, listen, if I have been exposed, let me call the hotline, 311. Let me let them know and let them guide me. Stay home and let them guide me. That is why that's the hotline or the center is there for, to guide you. We need everybody involved. We cannot appeal any longer, Dr. Pierre and Sergeant and Randall. We cannot appeal any stronger than that. No, let's say you've seen the modeling throughout the Caribbean region. One of the modeling throughout the Caribbean region, especially us with the small population, is that we have to stop all the moving pieces. As long as we have moving pieces, you have many conduits of the virus to other persons. This is where we know we'll move from local to community transmission, which is extremely deadly. So where we are saying, listen, we have hope. We want to be in that 80% that will recover quickly. And we want to make sure that we keep that 20% that may need that critical care at the all times low regarding all the other countries that have been impacted. How do we do that? By adhering to everything that we are doing. Is it possible, GQ, that we may need to have curfews? Is it possible that we may need to have lockdowns or a state of emergency until we could get everything under control? It's not under control, but we need to find those missing pieces, put them in the puzzle, and get us back to a state of normalcy. To contain, we need to stop the spread, if any. And so in order to do that, we need the moving pieces to be controlled. So I want the general public to start to think, bring ideas to the table, bring solution. The other challenge I want to appeal to everybody on is the misinformation. I think that is one of the greatest things that we are combating against right now, misinformation and what we call fake news. If we can do something about that, it will help the system, the national response system, to carry out the job more effectively in terms of the psychosocial impact. We are talking about the economic, but one of the things when we're doing our assessment based on our scenario-based analysis is that we said, listen, there's going to be a strong psychosocial impact on our society. And therefore, that's why we engage, and I want to thank Randon and his team for coming up, and we engage the mental and psychosocial support committee. And they were able to come forward right away with a strategic plan as to how they're going to support this response. Because it's critical. Because you just imagine, fake news go around quicker than the vital information that doctor is providing. Yeah. As they say, a lie goes around the world before the truth could pull up its pants.
Yeah. Indeed.
Indeed. So at this point in time, what we need is an all-of-society approach, because we are on charted grounds. I have never been through a pandemic. So this is a fluid situation that basically right now we have to be learning from and be able to respond quickly and immediately to these things. So GQ, I want to make an appeal to the general public for us to do what we need to do as patriotic persons of St. Kitts and Nevis to ensure that we do our best to stop this disease.
Thank you for being here, Mr. Samuel, Abdiel Samuel. He has an engagement to go to, so if you have a question for him, I do apologize. He's leaving the building now. But we're going to take some calls. Our first call, well, not our first call, but let's go to the line. Hi, good morning, you're live.
Good morning, and thank you very much for accepting this call. I just want to say that knowledge is power, and we have gotten a lot of information from the health professionals there, and I think that is quite important to us as citizens. Also, we need some calming in our life to alleviate the anxiety and the fear that we have. But most importantly, I just want to appreciate our first responders, our healthcare workers, because they are the ones who are going to be putting their lives for us on the line. And just this morning in the news, I heard of a nurse who was affected by the virus. And she's trying to still protect herself so she could help others. And I don't think we in St. Kitts and Nevis at this time, we are generous to our healthcare workers, and we are showing enough appreciation. Rather, we are finding time to argue and abuse and blame. But I think now is the time for us, as Dr. Liddy rightly said, to be our sisters and brothers keepers. I want to encourage people to canvass the streets that they are living in and see if there's anyone there in need who would like some assistance in getting medication, in getting food, in just helping them. So once we protect ourselves as citizens and we are well, we should help our first responders and not leave it up to the government, quote unquote, to do it, because this virus knows no identity, and the virus timeline is not the government's timeline, it is its own, and we should be in a state of readiness. And again, I want to re-emphasize that we must show appreciation for our healthcare providers. Thank you for this opportunity. And Dr. Pierre, you're giving some very good information too. Thank you everyone on the panel, and continue giving us periodic updates on the virus and how we could continue to protect ourselves and help each other for a blessed nation. Thank you.
Thank you for your support. Let's take this next call. Good morning, you're live.
Did you?
Hi, good morning.
Let the doctor know that I am not one of those persons. I am a praying person, and I've always been praying for the country and for the people. I was just concerned about the question. Thank you.
All right. Okay, let's take this next call. Good morning, you're live. We lost that one. Good morning, you're live.
Good morning, J.K. How are you morning, guys?
Good so far, sir.
And good morning to your panel. How are you doing?
Ask your question and then we'll forward on.
Anyway, I just like to get to this one. I heard one of your panel say that even you can be a threat to the instance of the virus.
That's correct.
Well, I would like to ask, what about the one who made the statement to you? Are he a threat too?
That is correct.
So we like to say, how can we combat this virus if we're not working in the emphasis of natural herb, only of scientific medicine we are using on the pattern of this treatment?
Like I said, they're listening, so after you ask a question, they'll respond.
Well, I hope they respond because it's time now we start one from the truth and we relate to the Creator because the divine Creator is who will able to fight all these deadly man-made disease. You all have a safe day.
All right, thank you. We're going to make a note of that. We're going to take a few calls before we respond. Good morning, your life.
Hey, GQ. Thanks for taking my call, sir. I would just like to say thanks to the Ministry of Health for putting the 311 in place. It's up and running and active. I checked it myself, and it's active, and that's great news. And thanks to the panel there, their hard work. They continue to work hard, and we want to thank them so much for trying to protect the people of this Federation of St. Kitts and Nevis. God bless.
Thank you for your call. Hi, good morning, your life.
GK, how are you?
I'm good, thank you.
Okay, wonderful. I just finished your program, so I haven't heard the audience say to it, but my thing is that it's here. And the officials have been saying when it comes, because we know it would have come. A lot of people are saying, we should have blocked the flight and we should have blocked that. But you cannot tell a citizen of your country to stay out there. You cannot tell a citizen of your country to stay in another man's land when he needs to come home. What I actually are concerned about is that if those people who are on the quarantine, although you have someone who are monitoring them, as you said, if they are going to stay confined to the area that you give them, or if I had an input in it, I would have done something different. I would have either acquired Fort Thomas Hotel, or release Fort Thomas Hotel, fix it up, fence it, put yard, and quarantine them in that area. But like I said, it all depends on the individual who are in quarantine, if they are going to remain in the area that they're supposed to be remaining in. And what we, as a general public, are supposed to be doing, if we know anyone who are supposed to be in quarantine and we find them out, we are supposed to alert the authority. Because although it confines to 2 persons, it may be confined to 6. We may have 4 more that come positive. But I'm saying that it can still here, because if it does not go around or everyone take precaution, it simply means that it would not spread. It spread when we do not take precautionary measure. That's my input.
All right. I know you guys are very competent, but I'm going to let you address those before we go too far.
Yeah. I mean, so that, again, outside of the last caller, and I think it's important to stress on the difference between quarantine and isolation. A patient in quarantine is not a suspected case. That is different. A patient in quarantine has 0 symptoms. A patient in quarantine simply has either proceeded from a region that there is community spread or endemic cases of COVID-19, or the individual has had some contact with a known confirmed case of COVID-19 but has no symptoms. And out of an abundance of caution, we decide to keep this individual to observe whether that individual starts demonstrating symptoms. We spoke earlier to the fact that, yes, quarantine, you want to be responsible, but you have real needs. You can be in quarantine and dying of starvation. You can be in quarantine and not have the means. The individual spoke of the Fort Thomas Hotel, which is in a tremendous state of disrepair. The question is, do you want to spend money on ventilators to save people's lives, or do you want to appeal to people to be responsible, to be your brother's keeper, to use spaces that may be used for something else right now? You may have a big house, you may have a downstairs that you say, well, you know what, I can keep 2 people downstairs in my home because I have the space, I have the resources to care for them. This is calling for us to come together, but be separate. I tell churches all the time, it's the first time that to show love is to keep your distance, right? That is what it is. But there are ways in which to show love, not by hugging and touching and kissing, but by actually doing things, rolling our sleeves up and doing things like using whatever resources we have at our disposal.
All right.
So people in quarantine, we have to ask first, well, why does someone in quarantine feel compelled to leave home? Well, because they need things. The question is, can we come together and make those things available to them? Someone spoke of natural herbs, right, being used. That's the reason why this can be very good. The road to hell is paved with great intentions, Great intentions. So herbs, I have nothing. I'm not knocking the herbs, and they think doctors like to knock herbs a lot. I'm not knocking the herbs. The thing is, again, as I said earlier in the show, we have a disease that we know so little about. In Italy, what killed so many people in Italy, you know what it was? Ibuprofen.
Wow.
Right? Because we now know that if you use anti-inflammatory drugs, ibuprofen, Motrin, Advil, naproxen, diclofenac, Voltaren, you are worsening the cause of the disease. So we are learning things about this as we go along. I don't know what is in a particular herb. I don't know what compounds are in there, right? But I know we have our garlic, we have our moringa, we have our neem, we have our ginger. We have things that we've used before to boost our immune system. I say go right ahead. But note that if you use something, you may be putting yourself at additional risk.
All right. Thank you, Doc. Sergeant?
Well, just before you go, Mr. K, and my last two questions were geared specifically at you.
Mm-hmm.
I know the COVID working group has found themselves fighting a fake news war, so to speak. And what happens when people believe this misinformation, and how important is it for them to filter out all the misinformation of quote-unquote fake news and pay attention to the cogent and salient information that is coming from the Ministry of Health, that is coming from the government, and for them to follow these instructions?
Okay. It's very dangerous, again, to as we said, to just read anything and just believe it one time. We've seen it in the U.S. For examples, when we were talking about comments were made about drugs that would work with to remedy the COVID virus. As the medical professionals, as we said, we don't have a found cure. But because of these news and rumors, people were taking medications they should not and were not prescribed, and ultimately led to their death. So it is very important that you understand where your source of information is from and where getting it from the correct outlets. We have provided that such in on multiple platforms. We have ZIZ, as I've mentioned before, SKNIS, the Ministry of Health. It is very, very important, I stress this, for everyone to be informed from the right sources. So before you share out something, ensure that it is the truth. As we said, we've created a network and a platform for you to do so. We have the doctors. We have those from the NDC, HEOC, the police officers. They're there to assist you. And I want to tie that into my comment where I was going to talk to the listener who was speaking on, he said, the natural herbs and the truth. And speaking of, because we're a very religious community and we believe in God. And he was talking about faith. And what I can say to this is, you have faith in God, then you need to have faith in the people around you, and you have to have faith in those who are trying to assist you. The disregard of frontline workers, the rumors, panic buying, all of this is coming from what I would say a lack of faith. As the man said, you have faith, you believe in God. Guess what? God made me, God made the doctor, God made the police officer. So now is the time for you to have faith in your community and have faith in those who are trying to assist you and trying to help you. You know, we have discussions where you're not believing the professionals when they said, you know, they're doing what they can and they're trying to assist you. You have to understand, you have to have that confidence, but without that confidence, that causes a breakdown in the system. You start to doubt what's going on, but you have to understand from this perspective, a lot of us have been trained and are aware of the situation. A lot of people have made the comment, we're just finding about this, the infection. Yes, it's a case that the infection and the disease is new, but the training and the knowledge and the expertise has been around for a while. I know Ablius has spoken and said, we started working on this months ago, but they have been trained on situations like this for years. So they know how to respond and they know how to react. So the only thing that is different, the only different component is what is the disease. It's new. But in terms of responding to it, they were trained. And you have to understand that. And then as a clinician and practitioner, and I said, okay, they understand the situation. I have to have confidence in my fellow man that they know what to do. So instead of me spreading this rumor, I hear this, I see that, I need to know with my faith in God. God made everyone else here. Have faith in them that they're going to do what is needed to ensure your safety. to make sure that you stay calm. A lot, we're talking about reducing that infection, leveling that curve. We're trying to ensure that, as the CMO said, it was not a matter of if, it was a matter of when. And I will say this, you will have to give credit to all our frontline workers for the fact that we were, they're saying we got these 2 cases. Guess what? We were the last country in the Americas to get a case. That speaks to the professionalism, to the direction, to our government, that we were the last. Because as I said, the CMO said, it's not a matter of if, it is a matter of when. We're now in when. Now all of us need to come together and try to ensure that we reduce this rate of infection so we do not overwhelm the health facilities. That is what we're trying to accomplish now. So all of us needs to do our part. And as you say, have faith in the frontline workers, that they're going to do everything to ensure that everybody comes out of this wiser, healthier, and go back to a realm of normalcy. I understand it's a difficult time, and we're stressed and we're worried. Trust me, I have parents, I worry every day. But I have faith in the people that I work with, that once this is done, I got a smile on my face, and all of us, Sunday church, back together, that community, it will still be there.
All right, what we're going to do, we're going to take a break. This is going to be our final break for the morning, and then we'll be back. I'll hand it back over to you, Sergeant Richards. Don't touch that dial. You're in tune to ZIZ Radio. Welcome back to the special edition of Policing with You, as we are dealing with the frontline workers this morning and answering your concerns and your questions. As a matter of fact, speaking about that, we're going to open the lines right now again. For those of you who would like to get in, who have a question for either Mr. Carr or the good Dr. Mr. Pierre, who is here, Dr. Pierre, 465-2555, that's 2555. And if you're overseas, 718-577-2916. We're going to be wrapping up the program at 11 o'clock for Frank and Candid. Sergeant Richards, while we wait for a call, do you have any more questions you would like to ask? Mr. Carrier said 2, or there was a 2-in-1 question.
Yes.
Oh, okay.
But GQ, there's something that I would really like to get Dr. Pierre's view and Mr. Carr's view on. There's a situation that would have arisen yesterday after the announcement was made by the Honorable Wendy Phipps about the confirmed cases. You notice on social media you started seeing 2 pictures circulating. One of the nurse who would have tested positive for the virus, and a young man who was found to be her son. So they lived in the same household. My question to Dr. Pierre, because I view that as not only insensitive, but just downright the wrong thing to do. Yeah. So I'm asking, how my question is, how does this situation affect, one, the ability of that nurse to function after she gets over the COVID-19 virus, because she now has to come back on the front line with the rest of us to continue combating this disease, and 2, how difficult does that make life for not just you as the medical professionals, but for the rest of society? Before you answer that question, Dr. Pierre and Sergeant Richards, if with your permission, can we put that to the end of the wrap-up? We have some calls. That is all right. Fine. That's okay with you? Absolutely. Okay. So, good morning. Thank you for holding on. You'll live ask your question, and then they will respond.
Good morning. Good morning to your panel. I have not so much of a question, but I just wanted to extend some encouragement and some advice as well. I have been basically, I think it's a self-responsibility. Each person has a responsibility to self first and then to others. I believe that it's a two-part. There's country and there's self. So, of course, the authorities have a responsibility at their level, and the citizens at their level have a responsibility. And that's how it comes together, and for this to work and for us to combat this. A couple of observations, because I also have been paying attention to what is happening within the other Caribbean islands. So I think it's important for us to collaborate a lot. I know that some of the islands experience certain things before other islands. I want to encourage that as well, because there are islands that have basically enforced certain things and they're getting certain results. So I would like to encourage that. I also want to, before I even continue, to thank the frontline personnel, I mean, the likes of Dr. Pierre and all the others. A heartfelt thanks to all of you. I am truly concerned about all of you because I believe that you have families, and it has to be of paramount importance for each individual, each citizen to understand that. And I also believe firmly that if need be, the authorities have to operate very strictly, if need be. Again, I have been paying attention to other islands and what they've been doing. And if there needs to be a curfew, like I heard one of the authoritative bodies on your panel say that if need be, there'll be curfew enforced and lockdown, that sort of thing. And these measures, I want to appeal to the citizenry that these measures are not put in place just to keep you enslaved or anything of that nature. It's for your protection. And there are people who don't show signs, they may not show signs, and they are healthy carriers. So I am doing my part, and I'm encouraging each person, whether they like it or not. I'm having the hard conversation, and I'm encouraging them, listen, if you have just arrived, if you come, because there are stories out there that saying that people are coming through and they are asked to self-quarantine, and they don't self-quarantine. So I want the authorities to look at that very closely. I know one thing that has been done, and I think a suggestion to you, I've heard a caller mention it, but not so much the ruins of whatever property that the caller was suggesting, but hotels can support. The hotels can support in a way that they can give of their property to be used as state quarantine areas, and then it makes it easier for the state to guard, to really look and guard those areas. So that's just one suggestion. But I really want to emphasize to the general public, take heed of what is being said. We have a way of being very reactive and not proactive as a people. I took it upon myself before this thing started. I started following this from November last year. No authoritative body told me to do so, etc. But I started following it from November last year, and I started understanding what's happening in China. And for us to think, oh, this is so far off, it will never reach our shores, etc., that is foolish thinking. And I think it's time for us to wake as a people and to do critical thinking and to support each other and to adhere to certain things and take the steps that we can take. Social distancing, I want to applaud what the information that's out there, but I also want to, based on something I observed within another island, though the authorities were speaking about social distancing, they found themselves in a place where they were not doing it. I mean, you look at them and a number of persons in the room, and they're close together, seated closely together. But these are all, because it is new to us, these are all learning. It's a process. But as soon as we recognize that, look, we're not doing it, let us just take the corrective action immediately, so that even the citizenry can recognize, oh, there are not two persons. Usually there are 5 persons within a talk show or whatever it is. Now there's just one person and everybody's conference calling or whatever the case might be. So we need to do those little things to really get the message across to the citizenry. It's extremely important. So I want to thank you for the opportunities for calling and encouraging you. Again, I want to say I'm very passionate about the frontline people, because we have families, and it is selfish of us to not listen and to defy what is being said to us as citizens. I appeal to us to listen, quarantine ourselves. If need be, you can call a friend, let them leave the groceries at the doorstep for you, etc. And let us support each other, that we support the nation that we. It is imperative, it is critical. And we don't want to stir panic, not at all, but we need to be very strategic in communicating to the citizenry how critical these things are. Because we're a small population, very small. Thank you so much.
Thank you. Gentlemen, I will let you address that caller how you see it fit best, and let you address Sergeant Richard's question as well.
Yes, I mean, we've been speaking, almost ad nauseum about the need for a community spirit. That community spirit comes compassion. You do no good at all in circulating the photo of an individual. First of all, you're violating. You see, there's something that we in the Caribbean, we so loosely speak about it, in the sense that somebody has a disease and we feel very comfortable just disclosing information, but private health information, and there are laws against that. When you've circulated a photo of someone, you're also saying this is the person with a particular disease. This disease is no respecter of person or status or creed or race. The impact study that was done has shown, and that's before this thing left the Asian continent, that 50% of our population will have coronavirus. Right now we're seeing that has been revisited. Are we saying 60 and 70% will have coronavirus? So when you circulate a photo of someone as if this is the person who will get coronavirus, you're making a mistake, because it's just a matter of time before someone in your family or yourself will suffer from that same disease. If you're going to circulate a photo of somebody, perhaps you want to rally individuals to support that person, to pray for that person, to find out what need that individual has, whether they need groceries at home, right? It's very insensitive. More so, Sergeant spoke to a very critical thing. This is an individual that we need, not want, we'll need to come back on the front line to serve. When you've done that, you've created unnecessary panic. Let's assume, for argument's sake, because I said earlier in my discussion that there's so much we don't know about this disease. Zika, for example, we didn't know that Zika was transmitted for months after in the male semen. Right? Yeah. Let's assume, for argument's sake, we find out that this disease is spreading by some route. Would you be comfortable being seen by that nurse, or is there going to be a stigma in the fact that this is the person who might infect you, because you come to the front line and you see her 2 weeks, 3 weeks down the line, and she's working, and she's past forced to come back to work? I just said earlier that the CDC is asking individuals, doctors and nurses who have had a high risk contact, meaning that somebody has confirmed COVID-19, to come back to work, because they just don't have the numbers. The flatten the curve we talk about, the length and breadth of St. Kitts has only 250 hospital beds. Wow. 250 hospital beds, GQ, right? Which means that if we're saying that 20% of the population will need hospitalization, of the 70 or so percent that gets it, we're talking almost 7,000 hospital beds will be needed. Just think of the distance between 250 and 7,000, right? So imagine if we have 500 people getting sick at the same time, and the length of hospitalization is about 7 to 10 days in a hospital, meaning that bed is not available for almost 2 weeks to somebody. And 500 people to get sick, it means that 250 people are without a bed. That is the reality we faced. Look at New York. They've had to put hospital ships in the harbor. We don't have that. And this is the first time we're faced with a crisis that the whole world is going through it at the same time. The whole world is going through it at the same time. So we can't look to our neighbors for help. We have to look internally and inward. So it goes against the grain of who we are. It defeats the spirit of community to share photos of anybody who has had the misfortune of being diagnosed with COVID-19. I want to appeal to individuals to desist from that practice. And we have a sergeant here, I'm not in law enforcement. If there are laws that can be enacted to ensure that these individuals can be brought to justice, they ought to. This is somebody in our community. This is a healthcare worker. And it is disgusting. It is to have to engage in that kind of practice. That is my take on it.
Gentlemen, I think we're going to wrap up now. I want to thank you guys for being here this morning. Dr. Pierre, Mr. Carr, Sergeant Richards. We were joined by Abdiel Samuel, who had to leave, and Dr. Liddy as well. And I want to thank all listeners who kept it locked throughout the time in the course of the morning and paid attention. I'm hoping that you not only paid attention, that you take some of the consideration, you consider some of the suggestions and recommendations that were suggested this morning. I'm going to let you gentlemen wrap up however you choose to do so. But for me, thank you once again for being here, and thank you for doing what you guys are doing.
Thank you. I would just like to say to the general public, as Dr. Liddy here and that. Let me rephrase this. The nature of people is to try and assign blame, figure out who. I think that's one of the reasons why they share that picture. They want to have that focus of going, hey, this is the reason this happened. In this situation, the issue is faceless. It doesn't matter your age, doesn't matter your race, doesn't matter your standing. It's going to infect you. So with that being said, as we've mentioned before, we need to be calm, we need to come together, and we need to stay informed and stay updated on the situation. We need to stop with the fear-mongering. We need to stop with the dissemination of not valid news, fake news. We need to come together, we need to stand together, and that is the only way we're going to get through this.
Yeah, on my end, I think one of the areas that we have not touched is, let's assume that we were to have a lockdown, for argument's sake, and we've seen it play out in other jurisdictions, where there's a lockdown on young people, and there's a simple reason for it. There's the 80% of individuals who will do very well on coronavirus, and there's a 20%, and that has been the sort of ratio that we've used so far. In that 20%, that's the group I'm hyper-focused on, because those are the group that's going to create the most strain on the healthcare system. What is particular about those group of individuals? Well, age, yes, but age is not inherently a factor, because it just means that if you live long enough, you will have suffer from something, right? So individuals who are hypertensive, diabetic, immunosuppressed because they're on cancer drugs, or even asthmatics, for example, who use steroids, autoimmune diseases. The list is very long, but not only is the list very long, we have these people in our families. And some of us are patients who suffer from these very diseases, right? What has happened in the U.S. that has caused tremendous strain is that young individuals have acted not as patients, but almost as vectors. So by not adhering to the rules of social distancing and staying put, because I have symptoms but it's only mild, they have been the one carrying the disease to the more vulnerable. And that's why it's so important that young people adhere to that, because you will be killing granny and auntie and mommy and daddy by not doing the things you need to do. So yes, you may not get very sick. You may not even need to call anybody for help, but you're carrying this virus to somebody, to a one that you love. And this is why it's so important that when and if these measures are enforced, that young people should act responsibly. And I think I would end on that note.
Thank you.
Well, GQ, for me, the stark reality is that whenever there's a crisis situation in any country, and I'll speak of the Federation, our legislation empowers essential workers, police, doctors, the health professionals. In this case, the COVID-19. The legislation empowers us with subsequent duties. That simply means that, separate and apart from our regular duties on a daily basis, we now have more things to do. We have more work to do. And that for us has stretched many of our organizations extremely thin as frontline workers. So what I want to do, I want to implore and beseech to the public, help us to help you. You know, if you have to remember that frontline workers have families. So when we have to deal with your non-compliance, that further puts us at risk. And then when you further put us at risk, then we put our families at risk. And then you end up with a far worse situation than was planned for had you only complied with the measures that would have been set out by government and by the authorities. So I just want to implore the public, please comply with the police, comply with the health, the Ministry of Health, the doctors, the government. Because I have to be doubly concerned because my wife is a nurse manager. So you find she too is on the front line.
Yep.
So please, I can't beg you enough. As Mr. Samuel said, there are too many moving pieces, and the moving pieces are what is going to cause this situation to spiral out of control. So please, again, I beseech the public, be compassionate. Comply with the police, comply with the medical professionals, and let's get through this safely and not have a potential crisis or disaster on our hands. I want to thank my panelists for being here, Mr. Abdias Samuel, Dr. Pierre, Mr. Kerr, and Dr. Lydia. I want to thank them for taking the time to come and inform and educate us, as well as debunk some of the myths, and GQ really prepare us for the fight ahead, because as Dr. Pierre said, it is a fight, and we're waging war with an adversary that we know nothing about. So I want to thank the listening public for listening. This has been another edition of Policing with You. Tune in again next week for another edition.
Oh, yeah,